Junior doctors are to down tools for their fifth and longest strike so far this year. The doctors in all DHBs, apart from Canterbury, have voted to strike for 5 days from Monday, 29th of April. Junior doctors have held 4 two-day strikes so far this year, and their collective employment agreement has expired as negotiations on a renewal have stalled. DHB spokesman Dr Peter Bramley is on the line and joins us now. Unprecedented 5-day strike. What is your reaction to this move?
Well, good evening, Lisa. Well, look, we're really disappointed as we think this strike action by the RDA is both unnecessary and uncalled for and is going to put significant pressure on acute care provision and certainly, unfortunately, is going to have significant disruption to planned care services.
So for patients, can you spell out what does this mean? When will you start cancelling surgeries? In what areas? How many?
Well, we've just learned today of the RDA's intention to strike for 5 days, and we'd certainly ask them to reconsider that. But our teams across the country will start planning for that 5-day period, bearing in mind if you add the weekends and the public holiday prior to that, it's a significant period of disruption. Our priority goes firstly to ensuring that we provide acute care safely for the people of New Zealand. And unfortunately, with the loss of the RMO workforce, that potentially will impact elective surgical procedures.
So in English,
well as outpatient care.
Yeah, so just in plain terms for people to understand, elective surgeries, what do you mean by that? What types?
Well, so people have a planned hip replacement or knee replacement or a planned cataract procedure, potentially those procedures might be deferred because of the priority to ensure that we can provide safe acute care provision.
What about some cancer treatments?
Well, cancer treatments, we would prioritise, our clinical teams will prioritise all activity in terms of priority care, and for some cancer patients, that care can't be delayed or deferred. So that would be the priority to keep that going. But there is going to be significant disruption on 5 days across the New Zealand health system.
I know you say it's just been confirmed today, but I'm sure you would have been considering your options given that this was a possibility. So ballpark, what kind of numbers are we talking for cancellations?
We don't know that as yet, and our teams will advise the early part of the week. But to be fair, on Friday we put a generous offer, an unconditional offer for settlement on the table with the RDA and asked them to present that to their members for consideration. And we've also supported going to the Employment Relations Authority for urgent facilitation. We're still talking. We still think we can constructively work our way through this, and that's why we're really disappointed that the RDA has now called for a 5-day strike action period.
Did they put that offer before their members?
We don't know. The information I've had to date is that I'm not convinced that all of the members have seen that offer. And we would certainly ask the RDA to present that offer, but also to reconsider this action. The priority has to be, firstly, safe patient care, and we believe we can resolve this constructively by continuing to talk. What
makes you think that they haven't put it before their members?
Well, I've not personally had any indication that that's gone to all of the RMO members across the country, but it would be great if the RDA can confirm that.
What pressure is the strike action going to put on senior doctors? Because there have been some issues raised around that, and previous strikes have been 2 days. This is 5.
Yeah, well, it puts pressure on all of our clinical teams, our medical, our nursing and our allied health teams. It also puts pressure on our clerical admin teams. But certainly this will require, and we're being really appreciative of our senior medical workforce stepping up to ensure safe care is provided through that 5-day period. We're also hopeful, as in previous strike periods, that a significant number of RMOs will still turn up for work. In the last strike periods, 2/3 of registrars across New Zealand have turned up for work. And remembering there is another union which we have now settled with, which has over 700 members. Those folk will still turn up for work.
How much does it cost you every day that they're on strike?
Oh, it varies across the DHBs, and we've not totaled that up, but the cost is significant primarily to the issues of patient care, and that's our primary concern.
But it's millions of dollars, is it not?
Well, potentially it's a significant amount to ensure that we can provide safe care.
So then, presumably you want to get it sorted as soon as possible, because the junior doctors have said to us that the sticking point is the veto power that they want over the rosters. So why don't you just give it to them?
Well, no, actually, it's the RDA giving us, removing the power of the veto that the RDA holds. What we've argued all along is that what our teams need at a local level is to be able to design rosters that suit local service provision. And at the moment, the RDA adopts a one-size-fits-all and effectively applies a veto to anything that they don't like. When senior medical and RMO teams and service managers have decided what's best for a locality...
So you are not prepared to shift on that?
Well, we think it's really crucial to, and RMOs have been telling us that as well. That's in part why there's so many members with stones, is that flexibility at a local level is crucial to ensure that we get the right care provision, but also the right training provision for RMOs. Given
that you both seem to have pretty entrenched positions, how confident are you that you can avert this strike?
Well, it's up to the RDA to reconsider, and we are asking, and we are hopeful that we will do so, remembering that we actually have agreed to go to urgent facilitation, and we'd ask them at least to give the opportunity of urgent facilitation, providing the recommendations of a way forward for us.
Do you have a date set for that?
We should hear from the Employment Relations Authority in the next couple of days, but we're expecting that to be, because it's urgent, hopefully in a relatively short time.
Thank you for joining us this evening. That is Dr Peter Bramley, who is the DHB spokesperson. And after the 6 o'clock news, we'll be talking to David Munro from the Resident Doctors Association. Get in touch if you have any questions or thoughts about the strike.